Welcome back to Skinfluence. I'm your host, Dr. Dustin Portela, board-certified dermatologist.
And I'm Austin Lee, physician assistant, specializing in dermatology.
And today we are here to make you sweat, or teach you how not to sweat.
If you're sweaty, it's understandable, but we'll try to help.
Yeah, calm down, calm down. We're going to be talking about hyperhidrosis today, or that's the medical term for excess sweating. Everybody should sweat a little bit, especially if you're physically active, maybe if you're a little nervous, but some people are sweating way more than normal in situations that generally don't call for it.
Yeah, they're just sitting at home or sitting in class and their hands are drenched. They can't touch paper. It affects their daily life. They get the swampy pits, which is never fun.
No.
And so it's a medical diagnosis. There's reasons why this happened. There's things we can do to help you. But so there's obviously, like you mentioned, there's primary sweating and then there's secondary type sweating. What's the difference between those two?
So primary hyperhidrosis means that the nerves are just too active, telling the sweat glands to produce sweat.
Yep.
There's no real explanation for it other than your nerves are just more active than they should be in this area. Secondary hyperhidrosis is sweating due to a cause that we can identify and treat. So some examples of that might be perhaps you are hyperthyroid. Your body is producing way more thyroid hormone. Your metabolism is very active. Your heart rate is high. And because of how high your body temperature can get in those circumstances, then you would begin to sweat. So that would be a secondary hyperhidrosis. If you're very sick and you're running a high fever, you might start sweating significantly. Or if you have a cancer, a tumor of some kind, or a pheochromocytoma, some of these weird conditions, you might then have flushing and sweating. But there's an underlying cause that ultimately could be identified and corrected. But in primary hyperhidrosis, there's no underlying cause. There's no hormonal imbalance. There's no tumor. There's nothing that we can say, this is the reason this is happening to you.
Yeah. And very often, to tell between the two, secondary hyperhidrosis, usually it's like full body. Like they're often sweating all over uncontrollably, whereas with primary, you're seeing a lot of sweating in like the palms of the hands, soles of the feet, armpits, and sometimes even the face and scalp.
Face and scalp. And so there's different treatment approaches that we will get to. But as far as triggers go, I mean, some people, it just is like that all day long. There's no specific trigger. For some people, it does get worse in the warmer months, but they're sweating even when it's cold. For some people, it's a social situation where they get nervous and they'll start to sweat excessively from their palms. And so sometimes you can identify the triggers. If you can identify a trigger, you can stay away from the trigger unless it's just such a common social situation that you can't really avoid,
Yeah, totally. I had a patient once who had this, and she was a speaker for a company. She represented a company to other companies. And so she was in front of people all the time, and just being in front of people made her sweat profusely. And so this was a bad problem for her because her hands would be sweaty, her face would be sweaty. And she wasn't incredibly nervous, but it was just being in front of people triggered that for her.
Right.
So, yeah, there's all sorts of reasons why this can happen. When do you typically see this show up in people? Does it start in kids, adults?
Most of the time, this starts in adolescence is when I have seen it the most. I don't see it a lot in prepubescent kids. It's usually starting when kids get into middle school and high school, and they start having, to change their shirt in the middle of the day because their armpits are super sweaty or their hands are super sweaty. Sometimes it's situational. I have had patients come in and they get nervous because they're about to have a skin check. They're worried and they're like, I'm sorry, my hands are so sweaty. But that doesn't usually happen to them. And that can happen in adults. So generally, the onset is going to be in adolescence, but it truly could happen at any time.
Yeah, I would agree. Most of my patients that come in are usually teenagers or in early adulthood, and I don't think I've ever really seen it in kids, in a pediatric or younger than maybe 12. But yeah, early adulthood, and I have some patients in their 30s come in and they have really, really sweaty hands. And I'll say, like, when I get emotionally upset or I'm undergoing a lot of stress, my hands are just clammy. They're not dripping in sweat. Like a lot of these patients that we see, their hands look like they have beads of water on them. So it's normal to do that, but if it's really affecting you negatively, or if it's preventing you from doing your job, or you're constantly having to wipe your hands and it's affecting your life, then there definitely can have a mental impact on you.
Yeah. So this is one reason that parents end up bringing the kids in, is because they're very socially self-conscious about this. Mm-hmm. They have to take an extra shirt in their book bag to school.
They can't wear certain colors.
They can't wear certain colors. A gray is just out of the question.
Totally.
And so they have to wear, solid white, and they can't keep reusing that. If they get antiperspirant on their deodorant, it starts to stain. Sometimes black is okay. So it's one of those things that takes a toll, because you start to become hyper aware of how other people might be perceiving you.
Totally.
And I've noticed people in public before that are like, wow, they're sweating a lot, and I have a different perspective on it than maybe the average person. But I would say that most of the time, other people don't notice. Mm-hmm. So
I've been in situations where, I think probably just because of what we do for a living, but I was at a birthday party for a friend of mine, and he had a teenage kid, and a bunch of the kids wouldn't lift their arms, and they were doing, I forget what they're doing, some activity where you want to like catch a ball, and they didn't really want to lift their arms up because they were sweating, and they had probably pit stains or something, and it's embarrassing. And so, it's an understandable thing to try to seek treatment, especially when you're a parent and you care about your kid.
Yeah. And sometimes people might not seek treatment because they feel like the treatments are all over the counter. I just have to try a different antiperspirant or a different deodorant. And, what could a dermatologist have to offer? But a dermatologist is the right place to go for this. And as we will explore shortly, there's a lot of treatment options that we can use that are pretty effective.
Totally. We have a lot of tricks up our sleeve nowadays. I remember when I first started practicing, there wasn't a lot available or anything really good, but now we have a few good options.
Yeah. Let's get into a couple of fun facts quick, and then we'll come back with the treatment options. So my fun fact is a condition called Frey's syndrome. Have you ever heard of this one?
I've heard of it.
Yeah. So Frey's syndrome usually happens when somebody has surgery that involves their parotid gland. And it messes with the nerves, because the parotid gland is one of your main salivary glands. And it stimulates the production of saliva when you start eating food. But if you've had surgery in this area, maybe for TMJ or a skin cancer or an ear, nose, and throat surgery, and those nerves get crisscrossed, then they get connected to the skin instead of the parotid gland. And so when you start eating, or sometimes even just thinking about eating, when you would normally salivate, you actually start sweating. And so people can just start pouring sweat off of a small area of one side of their face, because the nerve that's supposed to go to the parotid gland is actually going to the skin, and it's sending that same that same cholinergic signal, and all of a sudden you start sweating whenever you eat food. And so that's a very weird situation that people could become very self-conscious about.
Yeah, I've never seen it, and I would imagine that would be just an annoying thing.
Yeah.
Because you think about food, or you get hungry and you think about food, and all of a sudden you start sweating down your cheeks. I feel bad for anybody who has that.
Very rare for it to be bilateral. It's usually just on one side. But it would. I don't think I've ever seen it except online. It's kind of like Marcus Gunn syndrome, where when people are chewing, the nerve that's causing them to masticate is also connected to their orbicularis oculi, and so they blink with one eye every time they chew. And I've seen that online before.
Really?
So that's another one of those weird nerves getting crisscrossed type
Interesting.
things, usually after an injury or a surgery.
That's kind of a fun one.
Yeah.
That's a fun one. Well, mine has to do more with the people who have hyperhidrosis. Did you know that 5% of the population struggle with hyperhidrosis?
When we say that psoriasis is like 2 to 3%, we see way more psoriasis than we do hyperhidrosis. So I think people are not seeking care.
That's the issue, is people aren't coming in. Either they don't know where to go, they don't know that there's treatments, or it's embarrassing to them to have to talk about that with another person, and so they don't seek treatment. But 5%, it sounds small, but it's a significant number in a total population.
Yeah, that's a lot of people. So now that we've covered those, let's get into how you're going to treat this. So when you have hyperhidrosis, the most common location is going to be, we call it axillary hyperhidrosis, so the armpits. That's the most common spot. And the treatment that everybody will turn to first are over-the-counter antiperspirants.
Yep. And there's plenty of antiperspirants over the counter. You can go Dove. Most brands have their clinical strength antiperspirant, usually containing like aluminum or something along those lines to try to help stop or the sweating that in the armpits. But the vast majority of the time, they just don't work really well.
Right. Well, and that may be because people aren't using them correctly. So
that's true.
An antiperspirant is usually formulated with an aluminum salt.
Yep.
And so you'll look at it and it will say aluminum hexachloride or something. I mean, aluminum chloride is the original antiperspirant, and it can be pretty irritating to the skin.
It can.
And so they have created different versions of aluminum that are a little more gentle. But these aluminum salts can get into the sweat glands and actually block them so that that signal is being made, but the sweat can't get out. The best and most effective way to use even an over-the-counter antiperspirant is to actually put it on at nighttime.
Yes.
So you should shower at night and then make sure your armpits are completely dry, and then apply the antiperspirant before you go to bed. Because while you're sleeping, you sweat less than when you're active during the day. You're not in those awkward social situations. So there is more time for the aluminum salts to actually penetrate into the sweat glands. You can reapply in the morning, or you can apply a deodorant in the morning, but you'll get more mileage out of your antiperspirant if you start using it at night before bed.
Yeah, that's a great tip. And it's one that I don't think is readily understood or known. So, yeah, that's what I recommend that to my patients who sweat a lot. But it feels weird sometimes to put deodorant on at nighttime.
Yeah.
Before bed, you're like, is this going to hurt me? A question I get when I explain this to patients is they think you're blocking the sweat gland itself. Is that going to cause any harm? Is that going to hurt my sweat glands? Is that going to be harmful to me because I'm supposed to sweat? What do you say to those patients?
So it's not going to be harmful to you because you are sweating excessively, inappropriately. Your body is not producing that much sweat to control your body temperature.
Yeah.
And you're only treating the armpits.
Yeah.
So you're still going to sweat off of your shoulders, your head, your back, things that are more important for your overall temperature regulation. If you're outside and it's 100 degrees, you're still going to sweat sufficiently to help control your body temperature.
Right.
But it's just going to limit the excessive sweat that happens in areas that become a problem for you.
Sure.
Now, if your primary problem is on the palms of the hands, the soles of the feet, the scalp, the body somewhere, there are antiperspirants that are formulated for those areas. Now, certainly you can take a stick deodorant or a stick antiperspirant or a stick spray antiperspirant, and you can use it on those areas. Most people don't want to use the same one from their armpits on their palms.
Yeah.
So you can get a different stick and you can put it there at night before bed as well. But there's a company called Carpe. I have no relationship with them, CARPE, but they make aluminum antiperspirants in powders, in lotions specifically designed for the feet, the hands, or the body, and a stick, of course, for the underarm area. So they create that in multiple form factors that if sweating is your problem, that's a company that I would look into for an over-the-counter antiperspirant.
Yeah. There are prescription versions of antiperspirants or that we prescribe. One is Drysol, and it's doing basically the same thing like the aluminum that you had mentioned. It's just supposed to kind of plug those pores. I believe it is just aluminum chloride.
Yeah, it's a 20% aluminum chloride.
Yeah, and I find it works okay in some people, but for the most part, people still sweat and too much for their liking.
I've had good results with Drysol in patients, but most people start to get some irritation from it.
Yes.
And so the way that I instruct patients to use it is, of course, at night before bed on clean, dry armpits. The first week, you'll do it 5 nights in a row, and then you take 2 days off. The next week, you'll do it 4 nights in a row and 3 days off.
Yeah.
And then the next week, 3 days, the next week, 2 days. And the idea is that you'll get down to only needing to use it once a week because aluminum chloride is very potent. What I find is that using it 5 and 4 days in a row ends up causing irritation to people.
Right.
And it's hard for them to continue with it. Some people do end up doing really well on once, maybe twice a week. But a lot of people just don't tolerate it because it causes so much irritation. When I was in college, there was like a week period where I had primary axillary hyperhidrosis.
Yeah.
No idea why. Like I'd never suffered with this before, and all of a sudden I was just sweating like crazy from my armpits.
Interesting.
And I don't know what the change was. It's never happened again since. But I was given some dry sol and I was using that, and it worked perfectly for me. But I had contact dermatitis under my arms as a result.
Yeah, and it's not fun to have.
No.
You're itchy, you're irritated, it can sting.
Yeah. So that is the first prescription that we'll often turn to in patients. It's generally inexpensive. Most insurance companies will cover it. But after that, if it doesn't work or they can't tolerate it, there's a few other topicals that we can look into.
Yeah. One that came on the market a while ago now, I think it's been on the market for maybe 6+ years, is something called, the brand name is called Qbrexza, but the medication is called glycopyrronium, which is just sounds cool. It sounds like I forget what the metal is that Captain America's shield is made out of, but it sounds like that to me.
Kind of sounds like that,
Glycopyronium. But it's a topical acetylcholine blocker, basically. Yeah. It's trying it works at the nerve level, where it's trying to tell your nerves to say, don't send acetylcholine to the sweat glands, basically. And that one, it works okay. You put it in the armpits. Same thing. We like to have them do it at night, but I also have them do it in the morning often. And you could do it in the armpits. I wonder, I don't remember if it got FDA approved for the palms and the soles.
I don't think it got approved for the palms or the soles, but you could use it there.
Yes. You just had to be careful about not touching your eyes.
Yeah, and that is the big risk. So acetylcholine is a major neurotransmitter in your body.
Yes.
It is used in lots of different functions. So your sweat glands release acetylcholine as the signal that tells your sweat glands to start pumping out sweat.
Yeah.
But acetylcholine is also one of those things that controls the dilation and constriction of your pupil.
Yep.
It's in many functions of the brain. And there's a lot of medications that we use otherwise, even like Benadryl, diphenhydramine, that as a side effect has anticholinergic effects. And that's why it can make you feel groggy and sleepy in the morning. It's what helps put you to sleep. And it's why over long-term use of Benadryl is even associated with an increased risk of dementia.
Yeah.
So you don't want to be taking anticholinergic oral medications for long periods of time if you can avoid it, because they can have some side effects on the brain. And if you are using it topically, and then you happen to touch your eye and you haven't washed it off, it can cause your pupil to dilate and look like you've had a stroke on one side. And I know someone who did that.
Yeah.
They were using this in their armpits. They accidentally touched their eye and didn't know it, felt fine, but all of a sudden their family was just saying like, what is wrong? Your eye is huge. And they ended up going to the emergency room, getting a CAT scan because they thought she was having a stroke.
Oh, no.
But felt totally fine. And then just went through the medication history. Of course, I joke that the entrance to the ER is through a CT scan. Like you just lay down on the bed, go through the scan, and then you're in the ER. So they CAT scan everybody. But if you think somebody's having a stroke, you want to get that done quickly. And it was much ado about nothing because it was just the anticholinergic effect of Qbrexza accidentally touching their eye.
Dang it. That's kind of wild.
So we're very cautious when we prescribe this to tell patients,
don't
wash your hands very well after you apply this.
Yeah.
And don't touch your eyes.
Yeah.
So if you do want to use this on your hands, it comes with caution.
Yep. One of my coworkers, a nurse practitioner years ago, she accidentally touched her eye with it while she was driving down the road. And she was like, everything was blurry. I couldn't focus. She had to like cover her eye and pull over, and it was a whole thing.
Oh, my goodness.
She knew, fortunately, what would cost it.
Overall, I found Qbrexza to work well, but it is a brand name prescription, and it's still been pretty pricey at the point many patients can't afford it because a lot of insurance companies aren't covering it. But there is another alternative on the market called Softdry or Softdry.
Yep.
And it works in a similar mechanism, has some anticholinergic effects, getting in there, telling the nerve to stop sending the signal to the sweat glands. And this one comes in a foam that you pump out and then wipe under the arms.
Yeah.
Still a brand name, still pricey. Because it's a newer drug, there's rebate coupons, and you can jump through those hoops. And most patients with commercial insurance are not paying out of pocket for it.
Yeah.
But ultimately, those programs run out, and it gets really expensive.
Yeah. And it's frustrating because it can work for a lot of people, but access has not been ideal. Another option that we have is we have oral medications. So one of my go-tos is something called glycopyrrolate. Do you prescribe that often?
I do once in a while when we have exhausted the topical options and social stigma is bad for the patients. We'll start with a low dose of glycopyrrolate. This is essentially an anticholinergic.
Yep.
And so it really is effective at stopping sweating across the whole body.
Yeah.
So when I do give this to patients, particularly if they're athletes, I tell them, you have to be careful if you're playing sports outside in the summer because you're not going to sweat as much.
Yes.
And you are at risk for overheating. So take a spray bottle with you, spritz down, when you're taking a drink of water, get water on you to help get some of that evaporative heat loss. And it's also commonly going to cause dry mouth because acetylcholine is part of producing saliva.
Yeah.
It can cause dry eye because acetylcholine is part of creating the tears for your eye. And the anticholinergic effects could long-term have an impact on the brain.
Yeah.
And so this is something that we do use judiciously, hopefully for shorter periods of time. And some people with hyperhidrosis will grow out of it as they age. But in 2015, I matched as a bone marrow donor, and I had to go put under general anesthesia to donate bone marrow, and they took it out of my hips. And I remember, because I was a resident at the time, I was asking the anesthesiologist and the doctor, I want to know everything that you're giving me. And so one of the things they gave me was intravenous glycopyrrolate because they wanted to not have me produce so much saliva so that they could intubate me.
Oh, interesting.
And they didn't want all the saliva. And I don't know what dose they gave me. I'm sure it was only 1 or 2 milligrams.
Yeah.
I had a dry mouth for 5 days.
No kidding.
It was so bad. So I don't know if I was hypersensitive to it, but
maybe
the cotton mouth was atrocious.
Yeah.
From
that's
the
kind of
intravenous glycopyrrolate.
That's definitely the main side effect that I see that people complain about. And so I tell them, drink lots of water, chew gum, do what you can. But and it very often works. If it works well for my patients, I said, take it when you need it. You don't, if it's gonna be a Saturday, you're out doing yard work, something like that, you don't care if you're sweating, don't take it that day and the night before. But if you're going to be at a social event, you don't want to be sweating, it's there to take it. But we have to be pretty judicious with it. Yeah.
So ditropan is also, the generic name is oxybutynin, and it is also an anticholinergic. I've used this in patients before. It has an FDA approval for overactive bladder, where people have bladder spasms that causes them to urinate in their pants.
Yeah.
But it has that anticholinergic effect, which is part of the parasympathetic nervous system causing your bladder to excrete the urine.
Yeah.
But these people sweat less when they have to take it. They get dry mouth. So we can use this for hyperhidrosis as well.
Yeah.
I usually will go to glycopyrrolate first, and then if they don't respond well to that, we'll move over to oxybutynin. But most people respond well on glycopyrrolate.
Yeah. Sometimes finding the right dose is what you need to do for them. I've never used ditropan, but I can see how that works for sweating. Yeah. Interesting.
So let's see. Sorry, Carl. The other thing that a lot of people will read online that can help with this is Botox, the aesthetic drug that we use for wrinkles.
Yes.
How does Botox work for excess sweating?
So Botox it blocks acetylcholine in basically the same way that the glycopyrrolate will. But it's very localized, which is nice. So glycopyrrolate's an oral medication. You're going to get systemic effects, whereas the Botox will do that in a very localized area. When you inject Botox into an area, it does spread a little bit, but not very far. And so you're getting that inhibition of sweat, that inhibition of the acetylcholine passing across the neurons in a very local area, which is why it works so well.
Yeah.
The big issue is it's expensive, and insurance does not want to cover that.
No.
So you're either paying out of pocket, or I have found that neurology can sometimes get it covered. We were able to get it covered a long time ago in dermatology, but we got a notification from, I forget which insurance, but they said dermatologists are no longer allowed to do this under our policy because I think they think that we're also injecting into their foreheads for cosmetic reasons as well, which we were.
Not me. So remember how we said acetylcholine was a major neurotransmitter in the body? Well, it is also one of the main neurotransmitters that goes from the nerve to your muscles to tell your muscles to contract. And so when we inject that, it destroys a protein inside the nerve called SNAP25, which is part of taking acetylcholine from inside the nerve and pushing it outside of the nerve. And so it does that at the sweat gland too.
Yep.
So if you are a regular user of Botox, the next time you get Botox, compare that from when it has worn off to when you have Botox if you sweat on your forehead.
Yeah.
And you'll notice that you sweat less on the forehead after you get Botox.
Totally.
And that's why we will take it. Now, it's easiest to do for the scalp or the forehead if those are your areas of sweating. I've done it many times in the armpits for patients. It can be done other areas. So doing it in the hands is possible, but needle pokes in the hands hurt a lot.
It's painful.
And you have to be very careful because if you put too much Botox in or you go a little deeper than the skin, they can get muscle weakness of the hands because it's going to relax the muscles. So Botox, it works incredibly well. It only lasts about 3 months.
Yep.
And then you have to repeat it. So that's where it gets really pricey. It's not a permanent fix. It's a very temporary measure.
Yeah. I've had quite a few patients benefit from Botox in the armpits. It's a lot of pokes, but it's worth it to them, to those people who they don't have to think about sweating for 3 months, which is really happy. I've had a couple of patients where we did it in their hands. They were college age students who were they're with textbooks, they're on computers, they're doing things with their hands all day long, and their hands were just so sweaty, and it worked wonderfully for them. But it was not a fun experience when they come in, and it's a lot of pokes in the hands, but it does work really well. It's very effective, but it's pricey. You have to do it every 3 months, and it's not a fun experience.
No, generally not. So this gets us into a whole new avenue of treatment where we're looking for more long-term solutions. And there are devices on the market that can give that to patients.
Yeah.
And one of them is a device that you can get. You can buy it essentially over the counter and use it at home, and that's something called iontophoresis.
Iontophoresis is an interesting treatment because it's a device where there's kind of tubs that conduct electricity through them, but you fill the tubs with water a little bit, and you stick your hands or your feet in there, and they basically electrocute and shock your sweat glands, the nerves.
Yeah, usually there'll be a mineral in there as well that can get into the sweat glands, but you put your hands on the plates in the water or your feet on the plates in the water. Obviously, it's hard to do if your armpit is the problem.
Yeah.
But it's an uncomfortable sensation is what I've heard.
I've never done it.
Because it's like sticking your tongue on a 9-volt battery and you just got to kind of stay there.
And it's still about 20 minutes.
Yeah. But when you do this, it provides pretty durable resolution of sweating. It is not something that's a one-time treatment, but you can do it at home at semi-regular intervals and get really good control of sweating if your problem is the hands or the feet.
Yeah. This is one of those situations. I've had a patient bring it in and show me, and where following the directions is good, more is not necessarily better, because his hands were getting really irritated because he would say, I think the recommendation was like 15 or 20 minutes, and he was doing way longer because he felt like it was going to last longer, and it was just irritating him more and more. So follow the directions of the iontophoresis device, and it'll guide you exactly how to do it.
Yeah. The other treatment that is available is something called Miradry. So Miradry uses microwave energy, so very similar to how you would heat your food, but it's something that is applied primarily for axillary hyperhidrosis in the armpits. And the procedure generally is that you will do tumescent anesthesia in the armpit. So you're going to inject numbing solution in there that is dilute so that you take away the pain sensation, because as you can imagine, sticking a body part in a microwave is not going to feel very good. But this delivers a controlled dose of microwave energy that's not ionizing radiation. It's not going to break apart your DNA. It's not going to lead to cancer. But it's designed to penetrate just the depth of the skin. So it's not going in and cooking your blood vessels or your nerves. But it will permanently damage the sweat glands in the armpits. And usually people will go through 2 treatments of Miradry.
Yeah.
It is not covered by insurance. It is a cash pay procedure. And I think around here it costs $2,200, give or take. But if you start to compare that to Botox every 3 months for years, whereas MiraDry, you do it twice at $2,200 for the total treatment, and then it lasts forever, economically it makes sense.
Totally. Yeah. It's like how often do you have to get new contacts and new prescriptions, and then you do LASIK surgery and you pay for it and it's done.
Yeah.
And you're good. But yeah, there's a lot of really good options when it comes to hyperhidrosis, and it just depends on the trade-off for a lot of people. So what's the cost versus the benefits of any procedure? There's side effects to like almost everything that we talked about here, but what's the trade-off, and then how bad is it affecting you?
Yeah. The other thing we probably should mention is compensatory hyperhidrosis.
Yeah.
And this gets really frustrating. So if you sweat on your palms like crazy and you find a way to stop that, sometimes the body just wants to sweat.
It will find a way.
And so you shut off the hands, and all of a sudden now your armpits are the problem. Or your armpits are the problem. You get MiraDry, and your body says, all right.
You're back.
You're back. And
somewhere.
All of a sudden your palms are sweaty. Knees weak, arms are hidden. So this is incredibly frustrating when we find a resolution to hyperhidrosis, or you find even just a deodorant, an antiperspirant that works well. You shut off the sweating in one area and your body finds a way to sweat somewhere else. So it's called compensatory hyperhidrosis. And then we just start chasing it around. And that's where the oral medications generally are going to work really well.
Yeah. It's like in Jurassic Park. Life finds a way.
Finds a way.
Yeah, finds a way.
So over the long term, though, if you deal with hyperhidrosis, there are treatments out there available. We do treat this a lot, even though it's not something we see as commonly as psoriasis, but every week we're seeing somebody with hyperhidrosis.
For sure.
We're working with these medications, we're getting resolution and improving the quality of life for patients. And so this is the place, a dermatologist, to come and see if this is something that you struggle with. So don't wait. You don't have to suffer. You don't have to go through the social stigma and being self-conscious about it.
Yeah, and you're not alone in this. We see this fairly frequently in the office. There's a lot of people who struggle with this, and there's a lot of good options for you.
As we close out today, we're bringing up the Mantle skincare line once again, particularly the Invisible Daily SPF. So this is a gel-based sunscreen. We have lowered the price on it. So one is available for $10 and two for $15. We'll ship this right to you through shop.drdustinportela.com. Stock up on your sunscreen now before summer gets in full swing so that you're protected and avoid the brown spots, the lines, the wrinkles, and just the sunburns that you don't want to have to deal with.
Yeah, you don't need it. And this is a great protection. So
check those out. I'm Dr. Dustin. You can find me on all social media platforms at Dr. Dustin Portela.
I'm Austin Lee, and you can find me on most social media platforms at Austin Lee PAC.
Thanks for joining us on this episode. Leave us a 5-star review wherever you listen to podcasts, and we'll see you guys next week.